Alright, let's go over some information about burns and how to treat burns. So here are some important stats. The majority of burns happen at home, so it's important to know how to care for and treat burns, especially second degree, and what to do for third degree. So 20 million burns each year, 75,000 hospitalized, and of those about 3,000 deaths. What's important to know is that most of the people that die because of infection. So our skin protects us from outside pathogens. When it's damaged, those pathogens can get in, infections can occur, and of those deaths, I would say probably the majority of them are due to infection. Highest risk of death or illness related to burns would be children under 5 and people over 55. And the reason for that is both have suppressed immune systems. In children, they just haven't developed yet. They haven't been exposed to enough pathogens, so they don't have an immunity to a lot of the bacteria that would cause the infection. And in elderly, they're getting older and their immune systems are starting to not work as well. So we have different types of burns. We have thermal, which are heat related, chemical, electrical, and you could also classify some as radiation. So like a sunburn would be due to UV rays, and that would be more of a radiation burn. Those can be also classified as thermal or heat burns. So thermal, contact with a flame, hot objects, vapor, so steam. Most people don't think about steam burning you, but a lot of injuries that happen inside the house are the result of steam-related burns. And a lot of those can cause full thickness or third-degree burns. So exposure in water of 113 degrees can cause skin death to start to occur. 140 degrees for 3 seconds can cause skin death to occur. 156 degrees for 1 second can damage the skin or cause skin death to occur. And the boiling point of water is 212 degrees Fahrenheit at sea level. So first degree burns, this would be something like a sunburn in most cases. So we're talking about superficial, just on the surface of the skin, just the epidermis. So you have redness and skin starts to dilate. There's no scarring involved, and the outer and a lot of times first degree burns are the outer edges of deeper burns like second and third degree, but not a high risk of infection, mainly just painful because the nerves just underneath the skin are just being inflamed, or those areas are inflamed, so they can be painful. Second degree, partial thickness, so we're getting down past the epidermis into the dermis. Blistering starts to occur. That is a key indicator of a second degree burn. You can get a sunburn that causes blistering, and in that case, whenever you see blisters, think second degree. And a lot of that is just plasma weeping through. So the capillaries are damaged, they weep out plasma, swelling starts to occur, you get the blistering underneath the skin, severe pain because those nerves underneath the skin are exposed to that hot, inflamed, damaged area, and a high risk of infection, especially if those blisters pop open. Third degree, full thickness, so you've gone through the epidermis, through the dermis, down into the subcutaneous tissue, the fat and the muscle. It's damaged the vessels that feed the skin with oxygen, and it's damaged the nerves. So the nerves are destroyed, the vessels are destroyed, the tissue's dead. It's going to have to be removed or it'll get necrotic. So people that have third degree need to go to the hospital to be treated so that you can remove that skin. watch this video and answer the questions in the lecture notes. And then how do we determine the extent of a burn? So it's all based on size. So you have the rule of 9. So the rule of 9s is a particular area that's burned. So if I have one of my arms burned, that's a rough estimate of 9% body surface area that's been burned. So if you ever see BSA in these lecture notes, that's what we're talking about, body surface area. So one arm would be 9%, a head for an adult would be 9%, the front part of your torso, if that whole area was burned, that would be 18%, 18% for the back, one leg is 18%, and you can see the differences because infants and children compared to adults aren't proportional, so those areas change. So why is determining percent important? Well, if I have a second-degree burn that's over 10% body surface area, I need to go seek medical attention. It could be potentially life-threatening. Any burn could be life-threatening if it's second degree or above because of the high risk of infection. But if it's greater than 10%, you definitely need to go seek medical attention so that you lower the risk of infection. So that's why we're trying to determine how much body surface area has been burned. And you also have the rule of hands. So for scattered burns, you use the victim's hands, not your own, because I have relatively large hands, and if I tried to use that for my wife or for my child, obviously it would be a greater body surface area for them if I use my hand. So for, let's say I was burned and it was a scattered burn, I want to kind of get a rough estimate of the percentage of my body surface area that's been burned. I use the entire surface of my hand, and I use that to determine how large of an area has been burned. So when to seek medical care. So if areas are burned, face, hands, feet, genitalia, those are really sensitive areas with a lot of nerve endings. If it's second degree or above, you need to go seek medical care to make sure you don't have any permanent damage. If there's a circumference burn that goes around a limb, like a finger, a toe, an arm, a leg, around your neck, your chest, the reason that's important is because if it goes around a body part, inflammation can occur and circulation can be cut off. So in those cases where you have a circumference burn, you need to go seek medical care if it's second degree or above. Respiratory, so if there's a risk that somebody breathed in superheated air, so this happens a lot in the military or with firemen or somebody that's entered a building that's on fire and the fire flashes across, or they open a door and they get hit with superheated air that can burn the inside of the lungs, the alveoli, and so they need to go seek medical attention because they may not show any outward signs for several hours. So 2 to 24 hours later, they can start to have like pneumonia type symptoms. So they may have no external burns whatsoever, no outward signs that they've been burned, but they breathed in the air and the lungs are so sensitive they can be burned. And if they have any known conditions, medical problems, diabetes, heart disease, any type of lung disease, because there's a high risk of infection, especially for diabetics, and so they need to seek medical care, or any concurrent related injuries like fractures, internal injuries, open wounds. All of those are going to suppress the immune system or make it tough for the immune system to deal with the additional burns. So it's important to seek medical care. So body surface area and burn severity. So if you have a first degree burn that's greater than 50% body surface area, you need to seek medical care because it can suppress your immune system. Second degree, 10% or greater you need to seek medical care. High risk of infection. 3rd degree, any level, because that tissue has to be removed because it's dead, it's necrotic, it no longer has circulation to it. So you need to seek medical care. Often people that have 3rd degree burns don't really know how severe it is because the nerves have been damaged. It may burn around it for the parts that are 2nd and 1st degree, but for the 3rd degree area, they're not feeling any pain. So 1st degree treatment for that, cold tap water, pour it on there, cool it off, increments of 10 minutes for about 45 minutes. Ibuprofen, that's more for pain relief, inflammation that may occur. Have them drink a lot of water so they don't get dehydrated. And then aloe is good enough to soothe the wound and treat it, and elevation, just to keep circulation. Care for 2nd degree, greater than 10% body surface area, cold tap water, or really any 2nd degree wound. Increments of 10-minute cooling off periods with cold tap water to try to get it cool, reduce secondary death of the cells. Ibuprofen again for pain, inflammation, and then drink plenty of water. Antibiotic ointment, so a triple antibiotic ointment for burns to help reduce the risk of infection, and then cover with a dry, non-stick, sterile dressing. The reason you don't want a dressing to be placed on there really tight is because when they get to the hospital and that's removed, it can peel away the skin that's connected to the blister, and now that opens it up for infection. So you want a loose wrapped dressing, nothing tight, and nothing that'll stick to the wound. If you have gauze and you're afraid it's going to stick, apply more antibiotic ointment and put a coating across the burn, and then loosely wrap the gauze on top. And so that way when they get to the hospital and they peel the gauze off, it won't take skin off with it. It just takes part of the antibiotic ointment. That's another way. Now, the very first step for these, for 1st degree and 2nd degree, should be to cool the area off immediately. Get it as cool as possible so you don't have further damage of the area. And then these other steps can be done. Really, ibuprofen, antibiotic ointment can be done in any order, and then cover would be the last part. And the reason you cover is so that the wound doesn't get infected. So this is greater than 10% body surface area. You'll see it's pretty much the same as less than 10% body surface area, except now we have the additional part where you treat them for shock. Now, if it's greater than 10%, let's say it's 11, 12, 15%, 20%, it's unlikely that they're going to go into shock, but they could. If they have the larger amount of the body that's burned, the greater the risk that they could go into shock, because they lose a lot of fluid in those blisters. And that fluid is coming from plasma, the plasma in your blood. So you can get dehydrated and lose a significant amount of fluid in a short period of time that could put you into shock. And you always want to seek medical care for a 2nd degree burn greater than 10% body surface area. So care for a 3rd degree, cover it so you don't run the risk of infection the same way you would for a 2nd degree, and then treat them for shock. So there's no need to put any burn cream on there. Just get them to medical care as soon as possible. For chemical burns, you have acids and you have alkaline cleaners, you have organic compounds like gasoline. All of those can burn you. You want to remove the chemical as soon as possible. Most chemicals you can wash off. If they're embedded in clothing, you want to take that clothing off, because then that's going to keep that chemical against the skin, so the clothing has to come off. If you've ever taken a chemistry class, you've probably seen the signs in a chemistry lab where they show how they strip the person down, wash them off in the shower. There are certain chemicals that are activated by water, so you need to know what you're dealing with, but in most cases you wash it off. If it's something activated by water, brush it off. The problem is there's still residue on there that could still burn that individual. but for most chemicals, you can wash them off. Care for a chemical burn, remove the chemical as soon as possible, just like I said before. Remove the contaminated clothing, flush for 20 minutes or longer with water, cover, seek medical care. Electrical burns, there's different types. You have thermal, which is just the flame from the arc, and that's typically external. You have the arc where it jumps across to the person or in front of them, and they're in between wherever the arc is going, or they get close enough to it, it may not even make contact. Again, external burns. And then you have true electrical contact burns that are internal and external. So you're going to have an entry wound, an exit wound, and both of those will be areas that get burned, and then it's going to destroy the nerves and the vessels as it travels through the body, or it can. It can also put somebody in ventricular fibrillation. So there's a good chance somebody with a true electrical contact burn could have a cardiac emergency, put them in ventricular fibrillation. So you've got to be real careful when caring for electrical burns. You need to check the scene really well, unplug anything that may have caused the burn if you can get to it safely. So you want to make sure you don't come in contact with it, because now you'll have two victims and you could suffer the same injuries that the victim's suffering from and not be able to help them, and then somebody else could potentially get injured trying to help you. So turn off any electricity. Check for breathing, because there's a good chance it could have gone into cardiac arrest. So check for signs of life. If they're not breathing, begin CPR. If breathing, check for injuries, injury, exit wounds, all that good stuff. Treat them for shock, cover the burn, get them to medical care as soon as possible.